Sarcoidosis and pulmonary fibrosis. Sarcoidosis is a chronic, multi-system granulomatous disease that primarily affects the lungs. Tiny clumps of abnormal tissue, granulomas, form in certain organs of the body. Granulomas are clusters of immune cells. The cause of sarcoidosis is mainly unknown. It can also involve the skin, liver, kidneys, heart, and lymph nodes. Sarcoidosis is found worldwide. Risk factors do include genetics. It is often found among family members. It is 3 to 4 times more likely among African Americans and more commonly found in women. Symptoms of sarcoidosis include dyspnea, cough, and chest pain, although many patients are asymptomatic. Diagnosis of the disease is typically done by a biopsy of the lung tissue. The disease is staged and treatment is based on pulmonary function and progression of the disease. Some patients do experience spontaneous remission. Treatment for sarcoidosis is mainly aimed at suppression of the inflammatory response. Patients are then followed about every 3 to 6 months with pulmonary function tests, chest x-rays, and CT scans to monitor the disease progression. Approximately 30 to 50 cases of sarcoidosis get better without treatment in 3 years. About 20% of people whose lungs are involved will develop lung damage. The overall death rate from sarcoidosis is less than 5%. Pulmonary fibrosis. Pulmonary fibrosis is a chronic, progressive lung disorder typically found in older adults. Chronic inflammation and formation of scar tissue is found in the lungs. Common risk factors include environmental or occupational inhalation of organic or inorganic substances such as asbestos, silica dust, coal dust, and smoking is also a risk factor. Symptoms for pulmonary fibrosis is a non-productive cough, exertional dyspnea, inspiratory crackles. The diagnosis is typically done through a high-resolution CT scan of the lungs. Treatment and prognosis. Treatment includes corticosteroids, cytotoxic agents, and antifibrotic agents. There is no solid evidence, however, that any of these treatments improve survival or the quality of life. Lung transplantation can also be an option. The 5-year survival rate is approximately 30 to 50% after the additional diagnosis of pulmonary fibrosis.